Every day, our hospitals provide life-changing medicine and treatments to millions of people. Our ability to treat, care, and cure is more advanced than ever. So, why is hospital design still considered a luxury? An expense that needs to be justified? What if we rethink design as a crucial part of medicine and care? Can good design make a difference to our healthcare spaces? We asked the experts. Our research combines over 600 minutes of audio from 25 interviews across 12 trusts, and also includes speaking to artists and architects. This gives us a clear vision of how architecture, art and design are used, valued or undervalued in the NHS today.
Could the way they designed buildings, and particular healthcare buildings, could that actually have an influence on whether people got healthier quicker? If you had units with artwork or with better design, you could actually see that people got better quicker and people left hospital quicker and length of stay was shorter.
Interior design gets dissed. It is seen as a luxury that is expensive and has no place. But it so does. The problem is that it's driven on the budget on the day, and they won't look at what, if a little bit more spending is done now, what they could save going forward.
When we talk about design, we begin to understand the impact it has on healthcare systems. Design solves problems and creates space for us to move freely without friction. To put it simply, good design improves our lives in every way, from navigating hospital spaces to creating a safer, more friendly workspace. Let's take a look at some of the ways we can improve our healthcare experiences.
So if you're arriving as a stressed visitor or a stressed person who's about to go in and have an operation, you want them to just really easily find their parking, have a really pleasant walk into the front door, a really logical, easy route in the lift up to wherever it is they're going, instantly be able to see the front of that department, instantly be able to connect onto where they're going.
Making recognisable focal points in rooms, so that making different rooms different colours, so people don't have to, they got out of bed, they're not going to have their specs with them, but they will respond to that built-in sort of subconscious thing. Oh, hang on, my room's not blue, I'm in the wrong space. Go find the orange room. So those visual cues that help improve patient experience.
You're lying in bed, the windows are low so you can look out, you can see trees, you can see the sky. Even if it's just a seagull passing by, you have some natural light, and of course we all know it makes you feel better. Signage for me was a really important part of what I did. Way out signs, very, very important. Most people can find their way to a department, but when you come out, you don't know where to go. So we doubled up on way out signs.
Good design considers materials, colour, ergonomics, and combines them to create a better sensory experience. Inclusive, people-centred co-design has the power to help us all live better lives.
And good design is good for everyone. So good dementia-friendly design is good for everyone. Clear, pictorial signage. Good design is good design. It doesn't have to be specific for a particular condition.
Within the healthcare sector, I think that awareness of inclusive design has been there far longer, just because everybody who's coming there who isn't a staff member is coming there because they've got some physical or mental ailment that they are needing help with, and they're more vulnerable. And it could be people that aren't used to having a disability who are vulnerable for that period of time that they're using that building.
It's almost learning from what mental health hospitals do, where you appreciate this is the nature of what people are coping with who are here. Let's build the ward so that it can still do all the clinical things, but it's more empathic of the people and their needs that are coming through our hands.
So, what can good design do for us? It can improve recovery time. And reducing treatment time means we can treat more people. Healthcare professionals enjoy coming to work in a space that will enable better care. As a result, the patient experience is more positive.
Life satisfaction does not come from the objects that you own. It comes from feeling that you are valuable and that there is something valuable about life that's worth staying plugged in for.
You've got to care. And part of that is about ownership. Part of that is about longevity of staff, owning a space, but actually people caring. If that's the impression that comes across, surely that's going to build confidence in people coming in for treatment and their loved ones.
Invest in design and make the space around you change for good. You could say, the spaces we take care to design will take care of us.